Chair. So I had two broad areas of questions that I promise to keep brief. First one has been covered in part around staff, but one of the things I'm very conscious of is the real serious levels of anxiety for staff, but also for their families. One of the things that's happened in my constituency in Watford, which has been fabulous, is Watford Football Club, which luckily is next door to the hospital, has set up a sanctuary where staff can go in throughout their shift and during their breaks to get some support and respite and a break from it all. I just wondered whether that's something that's been looked at for rolling out across other hospitals across the UK, a similar sort of facility, yes, especially during the current crisis. And then the second, and as part of that as well, longer term, I just wanted to get a sense of how you're supporting the families of staff, because their anxiety levels for their family member who's going in every day to the hospitals must be incredibly high. And, you know, our doctors and nurses are incredibly brave, but so are the porters and the cleaners. And, you know, I just wanted to make sure they're all covered. And the second broad question, which I'll be really quick on, was just around tackling specifically the impact of loneliness. I know loneliness has an impact of something like equivalent of 12 to 15 cigarettes a day in terms of smoking. So it has a real physical health impact. You know, I really think as a society, you know, loneliness should have no place to hide. But I do think, you know, looking forward, how are we looking at dealing with that and the impact of that during this time? Thank you.
Yes, thank you very much. I mean, first of all, in terms of staff, absolutely across the country, NHS trusts are looking at creating sanctuaries, whether that's within the hospital or through partnership with others. And I think one of the best things we can do for families actually is to have our staff going home from work saying that they felt well supported and that they've had good access to things like PPE and they feel safe and they feel listened to. I think it's incredibly important. There's a lot of, the narrative is about our NHS and other heroes at the minute, and actually they are heroes. They are courageous because they are coming to work when they're frightened, but we need to be sending them home back to their families so that their families know we're looking after their loved one, our employee, our colleague, and that they've got the right access to PPE, which we've been focusing on very, very hard. I think as for families, we've not set up a bespoke service for families, but I would reiterate some of what I said earlier about mental health services are open for business, primary care is open for business, and if families are worried, they can make contact with GPs, mental health services and others. But I really think the best thing we can do is send our colleagues home with the support, PPE and everything else they need.
Could I just ask on that though, could we potentially look at how we can advise families on the communications bit, because I think families need to be given specific advice because it's their family member, their husband, wife, mother or husband who's going into that scenario, and I just think it would be really important to make sure families are aware of that, because it would heighten the anxiety for the frontline staff when they go home knowing that their families are really worried about them. So I do wonder whether that could be something